Postpartum hemorrhage is defined by the more than 500 ml of blood loss from normal vaginal delivery and more than 1000 blood loss following cesarean section, and it may be diagnosed by the deterioration of condition of patient, by general condition of patients, and there is a decrease in the hematocrit value less than 10%, and there is a chances of PPH is 1%. It is types are the primary or secondary. Primary PPH is defined when bleeding occurs within 24 hours of the delivery, and primary may be two types: third stage hemorrhage and true postpartum hemorrhage. Third stage hemorrhage which occurs when bleeding loss occur after the before the placenta removal, and true postpartum hemorrhage is defined when the bleeding loss occur after the placenta removal. And secondary or delayed and also called the late postpartum hemorrhage occurs when bleeding occurs following delivery of the baby after 24 hours up to the 6 weeks of delivery. And primary postpartum hemorrhage may be due to atonic causes, trauma and mix of atonic or trauma, and may be due to defect of a coagulopathy. And atonic PPH, it is the majority of the region of the PPH. It contributes approx 80% cause of the PPH, and it is the most commonest cause of PPH. It is due to faulty retraction of the uterus. It may be due to grand multipara patients and over distension of the uterus due to multiple pregnancies, hydroamnios and big size of baby due to the anemia. Prolonged labor due to effect of anesthesia, examples halothane, ether, cyclopropane, and due to uterine fibroid, precipitated labor, and malformation of the uterus due to septate uterus or biconate uterus due to antepartum hemorrhage, and the initiation and augmentation of the delivery by the oxytocin, it causes the faulty retraction of the uterus. And due to the traumatic PPH, is the cause the PPH by the laceration of the cervix, vaginal laceration and a perineal injury, any periuteral injuries, any maybe in some cases the uterine rupture causes the trauma of the pelvis. And the combination of there is a third region is a combination of the atonic or traumatic regions, and due to the fourth region blood coagulation disorders, it may be occurs in abruption placenta, jaundice patients, thrombocytopenic purpura patients, HELLP syndrome. There is a four main cause of the PPH which is denoted by the 4T, which is a tone, tissue, trauma and thrombin. Tone is the abnormality of uterine contraction. It may be occur due to over distension of uterus, which causes the polyhydramnios, multiple pregnancies and macrosomia, and uterine muscle exhaustion occurs due to rapid labor, prolonged labor and high parity, and intraamniotic infections occur due to fever and prolonged PRM, and functional and anatomic distortion of the uterus occurs due to fibroid uterus, placenta previa and uterine anomalies. And the tissue is the retained products of consumption in the uterine cavity which causing the faulty retraction of the uterus, which is the retained products, maybe abnormal placental lobes, and maybe the retained cotyledons or succionated lobes. These represent with the incomplete placenta at the delivery and previous uterine surgeries, any high parity of the patients, abnormal placenta of implantation in uterus on ultrasound findings, and the retained blood clots are also present in the atonic uterus. Or the trauma, these are trauma, genital trauma occurs in the laceration of the cervix, vagina, perineum, which occurs in precipitous delivery and operative deliveries, and extension and laceration at the cesarean section, which occurs in the malposition and deep engagement of the head, and uterine rupture occurs in previous uterine surgeries, and uterine inversions also occur in the high parity of patient, multiparity and fundal placentas. And diagnosis, PPH is diagnosed by the when vaginal bleeding may be occurs revealed or concealed, and the alteration in the pulse, blood pressure and the pulse pressure, and there is the flabby uterus in the atonic uterus. And prevention of the PPH occurs by the use of uterotonic drugs during the third stage of labor. After the delivery of the baby, delivery of the anterior shoulder, we give the oxytocin injection IM. It reduces the risk of PPH by more than 40%. Management of PPH is the early recognition of PPH is very important factor in the management, and the established plan is for the management of PPH is great value when the preventive measures have failed. Managing step first, initial assessment and treatment. Initial assessment is the resuscitation by large IV bore cannulas, oxygen by mask, and monitor BP, pulse rate, respiratory rate, and urinary output. For urinary output, we catheterize the patient, and then assess the etiology, torn tissue, trauma, thrombin, or any blood clots, and that send for the laboratory test for CBC and coagulation profile, and blood grouping of the patient, and send for cross match for the arranging of the blood. And then the directed therapy, if defect occurs in tone, then done by uterine massage. If uterine massage fail, then done for the uterine compressions and uterotonic drugs. Or for the tissue, uterotonic drugs are some uterotonic drugs which use only oxytocin drugs, which is that use 10 unit IM and maybe 5 unit IV bolus, or 10 to 20 units per liter we will given the patient. And the side effect, usually none of the side effect of oxytocin. There is a painful uterine contractions, nausea, vomiting, which is occurred due to water intoxications, and contraindication is the hypersensitivity of drug. Methyl ergometrin is given by 0.2 mg IM or 0.125 mg IV, and it is repeat every 5 minutes as needed, maximum 5 doses. And the side effect is peripheral vasospasm, hypertension, and nausea, vomiting. Contraindication is hypertensive patients are hypersensitive to drug. And third one drug is carboprost, which is 15 methyl prostaglandin F2 alpha. It is given by 0.25 mg IM, and it repeat every 15 minutes as needed, maximum up to 8 doses. And it causes the flushing, diarrhea, nausea, vomiting, bronchospasm, flushing, restlessness, and oxygen desaturation. It is not given in patients active cardiac, pulmonary, renal, and hepatic disease and hypersensitive to drugs patients. And one other drugs used are misoprostol, which is used per vaginally or per vaginally and per rectally, which is for therapeutic use, which used 600 microgram per rectally, and for the prophylactic use the 800 microgram. And second cause is tissue. In tissue, when the return products, which is removal by the manual removal of placenta and done by uterine curettage. And for the trauma, correct the inversion of the, if any inversion, correct the inversion, then the repair any lacerations or episiotomy sutures, and then if any uterine rupture, then go for laparotomy. And for defect of the thrombin, reverse the effect by the replacing the factors by blood products or anticoagulants. And then third stage is intractable PPH, the gate held by colleagues and surgeons, anesthetics, and ready for ICU or lab, and local control by the manual compression, by uterine packing, or by uterine packing by the uterine tissue, or by ballooning method or Bagley balloon method, or given vasopressin drugs, or by uterine embolization. And BP and coagulation effect correct by the crystalloid solution, and the blood products replaced by the blood product. And surgeries are the repair the lacerations, ligate vessels, which are the vessels ligate uterine vessels, iliac artery vessels, and ovarian arteries. And last is the go for the hysterectomy. After hysterectomy, bleeding occurs, then abdominal packing and angiographic embolization of uterine artery by the embolization method. This is method in this showing the B-link sutures for the uterine contractions, or the Cho sutures, and square sutures also used for the uterine compressions.